So Belinda says, hey, Raf, hope you're well. Have you done any podcast on sciatic nerve issues by chance, or what exercises help? I think I've developed a rather painful issue with sciatic pain from my left glute all the way down my leg. It's likely coming from my lower back, even though I have no pain in that area. I'm still exercising, lots of loading like squats and lunges. Not sure if that's a good thing, but it seems to feel worse afterwards. Anyway, I just thought I would check as I fear getting stuck down the physio rabbit hole of rehab. Well, Belinda, I am going to join your question with Candace's question, which is very similar. So Candace says, hi Raf, I'm hoping may be able to give me some guidance on Pilates with a psoas injury I've been carrying for about 3 weeks now. I've had 3 myotherapy treatments with 3 different practitioners, and at my most recent treatment, which has been the most effective, the therapist suggested I avoid hip flexor stretches and anything that puts the legs beyond 90 degrees. Up until this most recent treatment, I've been unable to bend past my knees and get up from a seated position without getting stuck halfway. I'm trying to draw on our training, but honestly feeling a little lost as to what I need to be doing. Would this suggest my hip flexors are taking over and that I should be working to strengthen the psoas? I would normally do reformer Pilates 4 to 5 times per week, but I'm struggling with 1 to 2 at the moment without a flare-up. Any pointers in the right direction would be greatly appreciated. Now, I did have a little bit of a further conversation with Candace over DM, this pain came on when she was it came on a Monday morning, and when she woke up, and then she thought back and thought, okay, what might have caused this? And she thought, okay, well, on Saturday I loaded 3 big folding tables in and out of a ute and lugged them around, and so it might have been that. And she said she has pain in her low back. What does she say? Pain in her low back radiating down to her hip and her glute and down the back of the leg, I believe, but no numbness, no change in bladder or bowel function. So we've ruled out red flags. So, and the pain for Candace also goes around to the front of the hip. So quite similar symptoms that Belinda was describing. So, Belinda, I think basically everything I'm about to say to Candace also I would say to you. So the first thing is if somebody has a new onset pain, is to rule out red flags. So, was there a traumatic onset? In this case, no, there wasn't, because it happened when you woke up. So that rules out a fracture or something like that. And is there any chance of cauda equina syndrome? So any change to bladder or bowel function, any, numbness in the seat, in your butt, basically, loss of muscle control in the leg, like your foot goes floppy or, you can't wiggle your toes properly, or muscle wasting. So presuming that we don't have any of those things, so that's not the same as pain in the leg. So if we've just totally lost sensation in the leg, or we can't move the foot properly or whatever, that's a cause for concern, and that's a red flag for cauda equina syndrome, and you should go to the emergency room. But in the absence of those symptoms, it is very likely garden variety sciatica, which is just irritation of the sciatic nerve that travels down the leg into the foot. And that irritation can occur in a number of places. It can occur inside the spinal canal, if there's a disc bulge or some other kind of stenosis, spondylolisthesis, some other kind of irritation in there, or just inflammation. It can occur at the nerve root, where the nerve exits the spinal canal. It can occur, outside of the spinal cord, as the nerve travels through the pelvis or through the back of the leg or whatever. So there are a number of places that the nerve could get irritated. Now, Candace, from what you've said, it doesn't sound to me like a traumatic, like even a too much too soon injury. because when you told me about the, lugging the tables out of the ute, I thought, maybe that could be some kind of a disc, irritation or something like that. But but the pain didn't start till 36 hours later. So that kind of doesn't totally make sense to me. Although, it's plausible, conceivable, should I say. However, like when you told me that you do Pilates 4 to 5 times a week, I think, all right, so if you're used to doing reformer Pilates 4 to 5 times a week, I think lugging 3 folding tables out of a ute doesn't sound like to me something that is way beyond your physical capacity. It sounds to me like you're well and truly fit and strong enough to do something like that if you're doing reformer Pilates 4 to 5 times a week. So to me, that doesn't sound like an unusual level of load on your body. And so it doesn't seem that likely to me that it's a traumatic injury. So I guess there are 2 possibilities. One is that it's a traumatic, that's some kind of injury. You've injured a disc or you've pulled a muscle or something like that. Or the second one, which I think is way more likely, is that it's a pain flare. It's a pain episode. And so either way, the treatment is fairly similar, which is good news. So the prognosis for sciatica, which prognosis just means like what's likely to happen if left untreated. So basically, the vast majority of people get better within 1 to 2 years. 2 years is absolute maximum. People who have a lot of people get better within 6 weeks. People who have surgery tend to get better outcomes in the short term, like as in less than 1 year, but in the long term, no better outcomes. So in other words, surgery just like hastens the recovery process. It doesn't actually improve your end result. So, unless your symptoms are completely unbearable, I would not consider surgery because there are obviously significant risks associated with spinal surgery. So if it's a pain flare, that would be basically your pain system is responding to a perception of threat to do with certain positions, and maybe that is, some combination of poor sleep, stress in your life, low physical activity, although that doesn't sound like it's an issue for you, and basically, various other sort of psychosocial variables. Or if it's an injury, it might be an irritated disc. It might be some kind of low-grade inflammation in your spine or nerve root or somewhere down through the course of that nerve. And either way, basically the recommendation is to avoid movements that cause intolerable pain, and to keep moving and keep as active as possible within pain tolerance. And you don't need to do special exercises, as in like moving in a particular way or flexing or extending or activating or anything like that. So, as recommended by your health provider, if stretching makes it worse, well, don't stretch. If stretching doesn't make it worse, if you want to stretch, but there's no particular benefit to stretching. And for you, Belinda, with, if you've got exercise that's making it worse, I would back off. I would do less. So don't do none, do less. Or just do different exercises. Try doing different exercises instead of those ones that seem to aggravate it. See if you can find either a lower dose of the same exercise or just a different exercise so that it doesn't aggravate it. And when I say aggravate it, I mean like if you get a bit of discomfort or pain whilst you're moving, that's okay, that's normal. But if it stays flared up for a day afterwards, I would find a different exercise or a lower dose, less intensity or less reps. And then just from there, with patience and a long view, thinking months of trajectory, build it back up. Gradually get back, to work back towards doing those exercises that were aggravating and those levels of reps and levels of intensity that were aggravating, and just gradually build it back up. And whether it's a central nervous system mediated, pain flare, or whether it's a, irritation or herniation of your disc or inflammation in your spinal canal or nerve impingement in the hip, the prescription would be the same, which would be avoid aggravating exercises or movements, okay? But when I say aggravating, I just mean ones that flare it, where it stays flared for a day, right? If it gives you a bit of pain when you do it, and that settles within an hour or two or even half a day, that's fine. You can do that. But you just need to reduce or change the activity to the point where you can tolerate it and it settles within a day after doing the activity. And then just, adopt a patient attitude and move forwards, within pain tolerance. So, keep doing that for a couple of weeks and then try doing a little bit more or a little bit something different that's a bit closer to the original exercise that aggravated it, and then just move from there. So I would say nothing in particular is off limits. I wouldn't necessarily say don't stretch or don't, move your knees past 90 degrees or anything. I would say if those things flare your pain, yes, avoid them or reduce them to the point where they don't flare your pain. But if there's no particular reason to do them either. So just do what you like doing, but reduce the dose. So if you like Pilates, which it sounds like you sure do, maybe try beginners classes or drop your springs right back when doing, lower body work. Or, go to prenatal class or something like that, and see if you can tolerate that. I definitely am in favour of you keeping moving, on a daily basis, but just, winding it back or changing the particular activities or exercises or positions that you're in so you don't flare it. And the prognosis is excellent, whether it's a disc bulge or whether it's a, inflammation in your sciatic nerve or whatever, or whether it's a pain flare, the prognosis is excellent. You're very likely going to recover, and it's just a matter of patience and keeping optimistic about it, and looking after your general health. Sleep, stress, diet, hydration, exercise, all of those normal things, and all of them will contribute to your improvement and recovery. So I hope that helps.